All right, hi, I'm Morgan Pesnell. I'm going to be doing the head-to-toe assessment today. Here's my ID badge, and then here's a 360 of the room. All right, and then this is Morgan Cups. I will be doing my head-to-toe on her today. Morgan, do I have your consent for this video?
Yes.
All right, so now I'm going to start my head-to-toe assessment. The first thing I would do is wash my hands and then introduce myself to the patient. So, hi, I'm Morgan. I'm going to be your student nurse today. And then I'd ask for 2 patient identifiers. So what is your name and date of birth?
Morgan Cups, February 6, 2000.
Then I'd explain the procedure and provide privacy for her. So then I'm going to start my head-to-toe assessment by examining her. I can see that she is sitting up comfortably and she feels comfortable. And I can see that she is well groomed. And then I'm going to look at her facial expression. I can see that she is content and her mood is appropriate for this situation. The next thing I'm going to do is check her level of consciousness by asking her a couple questions. Morgan, do you know what season it is?
Fall.
What time is it?
Around 1.
And then do you know where we are and what we're doing today?
At home doing a head-to-toe assessment.
So she is alert and conscious ×3, and I could hear that her speech was articulate during that, so I could hear her concisely. So the next thing I'm going to ask is, are you having any pain today?
No.
So now that she's not having any pain, if she was, I would ask her to rate it from 1 to 10. But now that I know she's not having any pain, I'm going to start off the assessment by taking her pulse and her respiratory rate. So I'm going to take her radial pulse for 30 seconds. Alright, so I could feel that her pulse was elastic. I would grade it a 2, and her pulse was 78 beats per minute, which is within normal range. And then I also was watching her respiratory rate while we were doing that, and it was 14 breaths per minute, which was normal. The next thing I'm going to do is take her blood pressure. Morgan, what is your normal blood pressure?
120/80.
Alright, so now I'm going to take her blood pressure. So I could hear that her blood pressure was 124/82, which is around her normal and is within normal range. After that, we are going to move on to inspect her face. So I can see her facial features are symmetric on both sides with no movement. Can you smile for me? Can you puff out your cheeks? So I can see that her facial features are symmetrical with movement. The next thing I'm going to assess is Perla. So I'm going to look at her pupils. I can see that they are equal and that they are round on both sides, and they are about 7 millimeters on each eye. The next thing I'm going to check is if her eyes react to direct light. So her pupils are dilating to direct light. Now we're going to check indirect light, which means we're looking at the other eye. Alright, and her pupils did dilate appropriately again. So now we're going to check accommodation. So can you look at the tip of the pen for me and follow it? Alright, and her eyes did accommodate correctly, so that is the end of her eye exam. The next thing I'm going to check is her arms. Can you put your arms out for me, Morgan? So I can see her arms are equal bilaterally and they are light beige in tone. There are a few primary lesions in the form of freckles that are sporadically throughout the arms. The next thing I'm going to do is palpate for edema and feel for temperature. Move your joint. Any pain? any pain?
Mm-mm.
All right, and there was no edema or joint pain, and I could feel that her temperature was normal. So after her arms, we are going to start to look at her chest. I can see that her chest is symmetrical on both sides and that she is not barrel chested in any way. So the next thing we're going to do is take a listen to some of the areas on her lungs to listen to some of the sounds. So the first area I'm going to start is right below her trachea. So right here we're going to hear bronchial sounds, and then we are going to move more towards her sternum, and here we are going to hear bronchial vestibular sounds, and then we're going to move more towards the bottom of the lungs, and there we are going to hear vestibular sounds. The next thing I'm going to do is listen to her lung sounds by doing 10 positions on the front and back to see if I hear any rhonchi or wheezing. So Morgan, I'm going to have you take a deep breath every time I move my stethoscope. All right, deep breath. 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 All right, and deep breath. All right, can I have you turn around for me now, Morgan? All right, and same thing, I'm gonna have you take a deep breath every time I move my stethoscope. All right, deep breath. 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 All right, and one more deep breath. All right, so her lung sound sounded good. I did not hear any rhonchi or wheezing, and now we're gonna listen to S1 and S2 sounds in the 5 locations. So we're gonna start on the right side of the body, which is gonna be in the second intercostal space, which is going to be the aortic. And then we are going to move to the second intercostal space on the left side of the body, which is the pulmonic. And then we are going to move to the third intercostal space, which is Erb's point on the left side of the body. And then we're going to move to the fourth intercostal space, which is tricuspid. And then we're going to move to the fifth intercostal space, which is mitral. And this one we want to be more middle. All right, and then I could hear her S1 and S2 sounds. We could hear them both, and there was no murmurs. So the next thing we are going to move to is the abdomen part of the assessment. So Morgan, can I have you lay down on the couch for me, please? So if we were in a hospital setting, I would have a towel covering her chest for privacy reasons, but since she is covered today, we don't have to worry about that. So the first thing I'm going to do is inspect the abdomen so I can see that it is beige in color and there's a few primary lesions in the form of freckles. And then I can see that it is symmetrical and it is flat, and that she does have a belly button piercing today, but that is not affecting her. And then for the abdomen part, we do auscultate first. I'm going to ask her if she's having any pain today.
No, I'm not having any pain.
So we're going to start in the right lower quadrant, but if she was having pain, we would want to start in the quadrant after the pain, so that way we can end in the quadrant with pain. So now I'm going to auscultate for bowel sounds in each quadrant, starting in the lower right. All right, and I heard about 12 bowel sounds per minute, which is within normal range. So now we are going to palpate for any tenderness or pain. All right, do you feel any pain?
Mm-mm.
Any tenderness?
No.
Any pain?
Mm-mm.
Any tenderness?
No.
All right, so now the abdomen portion of the part of the assessment is done. So now Morgan, I'm going to have you sit in a chair and put your legs out for me, because the next portion is the leg portion of the assessment. So I can see that her legs are even bilaterally and they are beige in tone with a couple primary lesions in the form of freckles. The next thing I want to do is palpate her legs for any pitting or edema. Bend your leg for you. Bend your leg. Alright, and then I can feel that there is no pitting or edema, there is no joint pain, and the temperature is normal. The next thing I am going to ask her, do you have any numbness or tingling within your feet today or
No.
legs? Okay, so the next thing I'm going to do is check the flexion of her feet. So Morgan, I'm going to have you pull your feet towards you. Alright, and now can you push your feet towards me? So we can feel that the reflexes were appropriate and that they were even on both sides of the body. So the next thing I want to do is look for any skin breakdown at the bottom of her feet, such as under her heels or between her toes, which there is no skin breakdown. So the next thing I am going to want to do is take the pulses on her feet. So I'm going to start with Duralis Pedis pulse, which is on the top of her foot. And I can feel that is strong and elastic. I would grade it about a 2. And then I'm going to move to her posterior tibial pulse. And then I can feel that it is also strong and elastic, and I would also grade it a 2. And now the head to toe assessment. Before I leave the room, I would want to see if she has anything else today, such as an IV, catheter, or oxygen, but she does not have any interventions, so that's the end of the head to toe assessment. So before I left the room, I would put both side rails up, bed in the lowest position, make sure her call light is in reach and that she is comfortable. And that is the end of the assessment.